Hello. So today I'm going to talk about today's day two of our series. I'm going to talk about a question that has been asked of me. And this question is also where do clinicians fall if they want to pivot into healthcare IT on the IT side? They're already healthcare, providers in different capacities, and they're wondering where they would fall. So, a couple of things about this. One of the things is that, first of all, if you're a nurse, a doctor, a therapist, or any healthcare provider, workers, thinking, I'm curious which area, which tech healthcare area I would fall into because I'm not technical. So where would I even fit? Well, you're not alone because there's a growing need for people exactly like you within healthcare. And I'll show you why or how that is. So I'm going to give you at least three reasons or three areas that you'd be really needed in this area. The first one is that, first of all, your clinical background is a competitive advantage. They really need now front workers who are the healthcare providers. They need them to really help during the design of some of the solutions that are being made. Any new innovations, any EHRs or things like that, they need your input. The patient engagements, where they're building all these tools, okay, where it's EHR for patient engagement, for AI tools, and all kinds of different solutions, home health care and things like that. So they do need people that understand the clinical side. And so you do not have to be a software engineer or anyone very technical, data analyst or things like that to really work within the healthcare tech industry. They need you just as you are with your skill sets from the healthcare clinical side. Okay. The second one is that the area where you might fall within the tech landscape. So there are different areas. Obviously, my list is not going to be exhaustive. However, I'm giving you some areas where that could be. So clinical informatics and implementation, this is a big area. Currently, there are actually many nurses that work in this area within the hospital system. So just so you know. And by this here, they need, your thought processes, your insights, whereby they're optimizing EHR systems or go lives, or even just the experience is being improved upon. So in this case, you may fall under roles that are, for example, clinical informatics, informaticist, and implementation specialist. You could be a super user. This is usually during the implementation where they train you and you train the people under you. In this case, it could be the clinical nurses, even though you're a nurse yourself that is probably doing the informatics yourself. You could be an Epic trainer. You could even be a clinical systems analyst, okay? On the clinical side, there's systems analysts within the healthcare system itself, but there could also be clinical systems analysts. And usually those are people who are helping to resolve or set up any kind of systems according to what the workflows are. Okay. So the second type of role could be a workflow design or product roles. This has become very useful in this era of AI and innovation. You'll find that there are many roles right now that employing any clinicians, whether it's MDs, DOs, NPs, and any others, nurses or any others, actually, therapists, different types of therapists, in these roles to help them design those different healthcare systems. And so this is an area that could be needed. So the role that you could fall under in this case would be something called like a clinical product manager or even a solutions consultant where they're using your insights to really help them as they design the product itself. Okay, especially if this is like a third-party product, which are many right now, and that they integrate into the bigger product. Let's say, for example, Epic, because it's the bigger one. with the bigger market share out there is implemented in many healthcare solutions. So you find that that is a role that those are roles, excuse me, that you could actually fall into and work under. The third one could be even health tech sales or training or customer success. And these are very, very useful. You find that, again, I talked about third-party solutions these days that are being created. You could help really, if it's tech sales, you're helping to speak in a clinical setting where you're going to speak to other clinicians that are going to make those decisions. You could find that it could be chief medical information officers, chief nursing officers, anyone who is in a position that makes a decision for perhaps new solutions. You could also be helping with training. It could be training actually fellow clinicians in the main bigger companies, in this case, in the main bigger healthcare systems, where like a third party solution is being implemented and you're helping them to know how to navigate those new solutions, system solutions, in the context of the existing and the bigger solution, something like 𝐸PIC, okay, if it's going to integrate with it. The other one would be customer success. This would be very important because in this case, you are really being the voice of the customer. You are really talking their language and you're helping them to understand those roles and to ensure that actually as they're implementing these new solutions, that they are very successful and that you are able actually to answer the questions from a clinical perspective. Okay. So you find that these roles tend to have empathy, clinical judgment, and also a good understanding on the clinical side. So that it gives the ability to communicate with both the users and the internal teams. Okay. And it would really be helpful. Okay. So the third one would be where the technical skills can be learned. Okay, they can be learned, but your clinical insight really from your background, it cannot necessarily be learned or taught. It has to be that someone has actually had the experience of working in that area. And so that's why they need your input, your insights, and also that expertise. So you find that again, you don't have to be necessarily technical, but where perhaps your technical side might come in is your prior skill set of using the technical systems. In this case, like 𝐸PIC, we know that the chart management or any documentation or even coding actually, where it might be needed, where they're asking maybe for your particular expertise, especially if you go where there are some specialist systems that are being created for certain specialty areas. It could be orthopedic, it could be maybe oncology, or areas like that where they need your expertise. Okay. So again, you find that when you also are open-minded, and if you are anyone who is a clinical professional that would like to actually move into some other areas, there are really opportunities for you for doing that. Okay, so in closing, I would say that if you're a clinician who is looking to make a leap to start where you are exactly, again, if you look at my explainer video from yesterday, I say that if someone is doing a pivot, you're not really starting from the ground. You're really starting from where you are and just adding to that. We all are, for anyone who is pivoting or getting into new areas. So therefore, you don't have to necessarily be a hard coder. You don't have to necessarily be very technical, but it's your healthcare and clinical insights that are being sought after. And that is exactly what they need you for. Okay. So having said that, again, I'm also going to do a demo here. I want to show what are some of the areas that you could actually go in, just to give some examples. Okay. So let me pull that up and then we can see here. So let's share the screen. I think this is it. All right. So we have an example company here. The company is called Ambience. And as you know, maybe, sorry, Ambience is a company that is helping to reduce the burnout for clinicians by helping to transcribe, you know, ambience. In other words, it's in the background, but it helps to transcribe as clinicians are really having visits with their patients, and that it can transcribe that and actually also integrate it within the EHR automatically. Okay. So here I wanted just to show you example of this. So the first thing is we see here they want a physician AI researcher. So if, for example, you're a physician, there are many who are interested in AI, and you could it says full time here, and you want to pivot into this area. Again, you don't necessarily have to be very technical. What they need is really your clinical insights. Okay. So without going into details here, these are some of the things they'll want you to do. What you will do, you prototype and experiment with state-of-the-art models. Okay. You're going to help them really use the system and see, is this working as it should, or can it work even better as far as workflows? You're also going to be helping with design, as you can see, which is a big part of where they need clinicians. You evaluate and refine the AI models. This is something actually you can learn to do with them as far as the AI models. And then also curate and audit data sets, meaning that if there's any data, you actually will advise them of what areas or things to do there. You analyze feedback and resolve issues with AI outputs. This is where you will find the outputs and determine if they're good or not using your clinical insights, as you can see, and analytical skill sets. So, of course, many clinicians are very smart in terms of analytical, meaning that if there's something that you see, you will analyze it and, help whoever the designs are. Because most likely you'll be working with designers in this case. Okay. And so they say here who you are. You're someone with an advanced degree. It's an MD, DO, I think even NP and others with hands-on experience in medical documentation workflow. So you've been already doing this, and they want your insights. You can help with that. And you have strong communication and adaptability skill sets, and also problem solving, which is what many, clinicians do. Commitment, continuous learning. The reason for that is most likely because they'll be teaching you probably the AI part of it, and also really guiding you how to go about that. Okay. Of course, this would be for someone who is in the San Francisco area because they want someone who can work there 3 times a week. But I wanted to give you an idea. And also, these are some of the other pay transparency, as they say, and the benefits that come with that. Okay. So, let me just go back here, open roles. I just want to show you what. So this was the role we talked about. Another one would be this one, care transformation executive. This is not necessarily for just clinicians, this particular role. However, it's also for it could also be like people who have been doing consulting, as you see here. This is really where you have 6 to 10 years of experience in health tech implementation. I'll actually talk about this tomorrow. But I wanted to show you that you may not necessarily, even though they're saying it's not clinical, you actually could also apply for something like that. Okay. So another one I wanted to show also is this one with a company called Twins. They literally need nurse practitioners. Okay. These are the roles. Let me actually show you. Several of them are clinicians. This is for where it's also like telehealth a lot, but they're specifically working with people with chronic diseases. Okay. So that is the reason. And so you see that they do need several people in the on the clinical side. You have telehealth physician here. Okay. They talk about that. We're seeking energetic physicians to help and be part of this with telehealth. MDs, DOs, also that who are board certified in internal medicine and family practice. Okay. And then here, let me see. That's a telehealth physician. I'll go back here. And where is that clinician here? And here you see they have the nurse practitioner. That was a telehealth practitioner we talked about, a bilingual member support associate, and then also physician also in a particular state. But most of these are remote. This one seems to be in person, remote, but based in South Carolina, probably for a reason, in case maybe sometimes they may need someone there. And you see the compensations there, for sure. Okay. So that's what I wanted to run by you. If you're someone who is looking to pivot and you're looking for some kind of mapping. When I talk about mapping is, just getting together and seeing exactly how to position yourself for these types of positions or roles. Okay. Feel free to reach out to me. The information will be in the description below. Okay. So thank you very much and good luck. And I hope that you'll be open to these types of opportunities. Thank you.